Okay, so for my skill today, I'm going to do inserting and maintaining an NG tube. The first thing I'm going to do is check the suction on the wall to make sure that it works. I'm then going to place the client in high Fowler's position and explain the procedure to them. I'm then going to have the patient pick the most open nostril by plugging one side of the nose and breathing out. Same on the other side and picking which one they breathe better out of. Next thing I'm going to do is, with clean gloves on, obviously, I'm going to measure the tubing from my nose or the patient's nose to their ear and then down to their xiphoid process. And that will be approximately how far the tube will need to go down. So I'll make a marking on the tube so that I know when a good time to measure would be. Next thing that I'm going to do is lubricate 3 inches at the tip of the tube, which I don't have, so I'll just pretend to do that. And then I will have the patient tilt their head forward like this, and then I will begin to insert the tube. As I'm inserting, I will have the patient sip with a straw a glass of water to be sure that the epiglottis is closed. Once I get past that, I will continue advancing the tube, stopping if the patient is gagging or vomiting, but never taking the tube out. Then once I get to my part of the tube that I marked off when I measured, which I can't go further up this bottle, but I will then tape it to the patient's nose. Once I'm up to the point where I wanted to be, I will tape it to the patient's nose, and I will verify the tube placement by aspirating some of the gastric secretions and testing the pH. The pH should be below 3 if it's in the stomach. I will then connect the suction and document for my patient, document how they handled the procedure and all of that. And that's what I would do.